Good morning, it's Christine Ko, the Global Marketing Director for IT Solutions. Day 4 of RSNA 2013. Power of Partnership this year. I'm here with Brian Casey of AMMinnie.com, our go-to source for anything radiology.
Thank you, Christine.
Thanks for joining us. So, Power of Partnership. I mean, what's your interpretation of that, and how does that relate to maybe some of the things you've seen here at RSNA?
Okay, yeah, I think it's a great theme. What that means to me is that vendors such as Carestream and other vendors out there are going to have to start working more closely, I think, with a lot of their customers to develop solutions that are going to help radiology out of this kind of period of stagnation that we seem to have been in for the last few years.
Right.
And, you know, it's kind of the elephant in the room, but it's something that we all have to deal with, which is that radiology needs to change if we want to stay the vibrant specialty that it's been for decades and decades.
Right, and continue to be part of that care spectrum within the enterprise.
Exactly.
Right.
And the topic of innovation has been a big issue because radiology's growth has always been based on innovative technology. Coming out with CT and MR and PET CT and PET MR and all these iterations, PACS and healthcare IT. Every new technology that comes out is another step forward for radiology and is another way that radiology kind of maintains its position as one of the premier medical specialties. And it kind of seems like that pace of innovation has slowed down a little bit.
A little bit,
And so I think that it's incumbent on vendors like Carestream to work with a lot of your luminary sites and your best customers to keep that spirit of innovation going.
Absolutely.
And it seems like the way that innovation really needs to go in the future is toward first better workflow and more efficiency.
Of course,
and
always,
helping radiologists do more with less, which is kind of what it's all about. And also helping radiologists kind of get out of the sort of bunker mentality of being in the dark workroom, the dark room in the basement, and getting in front of referring physicians a little bit more. I talked to Dr. Paul Chang yesterday of the University of Chicago, and he said he was talking about this concept of multimedia radiology reports, enhanced radiology reports now, and he said, well, back in the old days, nobody ever read our reports because we would just go and talk to the physicians.
Right.
So they didn't need to read the reports. Well, that's not really the case anymore.
Absolutely.
Reports are the finished product of the radiologist, and as such, they really need to be multimedia. They need to have all the information the referring physician needs at a glance, and they need to be easy to produce and easy to read.
Absolutely, simple to digest, and then right away, just changing gear, if you will, from just trying to interpret the data, but to actually actionable clinical care.
Right, exactly.
Absolutely, and that's part of the reasons why we're focusing our launch this year on View reporting is exactly that. It's a multimedia structured reporting geared towards referring physicians and hoping to add more value.
Great.
So thank you so much for joining us as usual, and any parting words with our readership?
Day 4 at RSNA, got one more day to go.
Absolutely.
So it's always a good feeling.
Exactly.
Right.
Well, thank you so much, and see you soon.
Great. Thanks, Christine.